So I'm going to log in here as a patient, and I'm going to show you what's coming in 2018. So this isn't the only thing we can do for video visits, particularly on the patient side of the MyChart integration, but it's the latest and greatest.
Got it.
I'm trying to show it off today.
Okay.
So I'm going to log in here as Andre Kissin. When I get into my MyChart account, I have a pretty standard overview. I have some alerts at the top that give me things like things I'm overdue for. Are you familiar with MyChart in general?
Yes.
Okay, great. Then I'll skip half of the stuff I'm going to say. The new thing is this talk to a doctor link, and that's specific to our on-demand workflow. So once I choose this option, I'm taken into this streamlined flow where I can get a video visit with the next available provider, not only inside my organization, but also outside of my organization if no one's available inside.
And can that be constrained so that a patient who might, be, for example, be chronically ill only see members of their immediate care team?
It can be, but that's not the design for this.
So it's designed for sort of open access to any medical provider who's available, basically.
Right. And it's designed for urgent care complaints rather than chronic care conditions.
Got it.
So it's designed for the things you can handle right away with this.
Got it.
Well, this is interesting. This is not the build I've been using all day. I wonder if I'm in the wrong environment. Let me try this one more time, and if it is in fact that it's changed since I demoed this 2 hours ago, then we'll just go through it and see how far we get. Weird. Okay, well, normally I have 4 different reasons for visit that are configured here. Apparently right now I only have 2, and it looks like that's probably because I don't have availability for my on-demand workflow. So I only had the option to schedule with my provider.
Got it.
What we normally see here is 2 options. I can choose to wait in line for the next available provider.
Right.
And that depends on people actually being checked into the pool. So what we're running into here is no one's checked into the pool to take this visit.
Physicians, providers. Yeah.
Well, it doesn't necessarily have to be
or
physicians.
APNs or whatever.
Exactly.
Yeah.
So advanced practitioners are going to be probably the primary users of this.
Oh, really? Okay. And less so physicians.
Right.
And why is that?
Mostly because it's designed for complaints that are easily treatable by protocol.
Right.
So the things that CVS would handle in the Minute Clinic, we want to be able to handle virtually as well. So I'm going to choose to schedule with Dr. Walker, who is a member of my care team, and I can add some additional details. So Andre woke up with some itchy eyes this morning. And he's worried it's pink eye. Pink eye is a great example of something that's very treatable through video visits.
A self-limiting condition.
Yeah. Also, huge win if you can get antibiotics without exposing anyone else to it. So here, I'm taken to my appointment details screen, so I can join my video visit directly from here. I also have the option of completing e-check-in, and what we usually see is folks require that a patient goes through the e-check-in process before joining the visit to collect payments up front, to collect any additional clinical information, and to collect consent forms.
Got it.
So we have it set up so it's not required just for the sake of the demo, but you certainly can require it. I'm actually going to switch over to the patient on the mobile device here, so I can use the webcam for the doc. Let me log back in here, and I can actually show you what I'm doing.
So in other words, a video visit has to be conducted on the patient's side on an app. It's not conductable in a web client of any kind.
Well, you can do it on a web client. It's just easier for me to demo it if I do it on the app.
Okay, so there's a web interface as well for the patient.
Exactly, yep.
And can you bring specialists in as well during the course of the exam? In other words, another provider who
You can with, it's vendor specific. So what I'm going to show you is the integration with VIDYO. We integrate with, we have 6 vendors live, 2 more piloting, and then a handful more who are in the process of implementing their integration.
Which are basically just video conference systems, basically, like, for example, Zoom.
Yep, yeah, exactly.
Okay, got it.
So I'm going to connect to the video visit. So this is my patient view. Does one of you want to pretend to be the patient?
Sure, the doctor can be. Take it, doctor.
So I'm going to switch back to the desktop side and show you what it looks like from the clinical point of view.
So there was no review of systems or workflow involved in, other than a specific complaint was typed out, pink eye. Okay, got it.
That questionnaire that I skipped past, that's where you would collect that HPI, that ROS for the patient.
Got it.
So when did I schedule? 6:45. As the wrong provider. That's what's going on.
Yeah, you need to log in as the provider that you had.
Yep, exactly.
Right.
So now I have this video visit with Andre, and I have this video visit icon, and that's my indication that this is a video visit in general, but the green specifically indicates that the patient is there and waiting for me. So I can see at a glance who is ready for me to jump into the video visit and who I should wait for until they're ready.
Got it.
This video piece is my support staff could jump in. So if I'm running 10 minutes late, my MA or my RN could hop into this video call with the patient, say, hey, it's going to be about 5 to 10 minutes. Can you please hold? In the on-demand workflow, we also have a way to text the patient or to send them an email. So instead of them sitting in the waiting room waiting for me, I can instead let them know, hey, I'm about 5 minutes from being able to see you wedding hop into the video.
Got it.
Now. I can double-click this video icon to jump straight into the actual visit. It's gonna take a little bit because the Wi-Fi here is terrible, but normally we wouldn't see nearly as much of a lag as we normally do. The big key though is all this documentation. This is the same Epic that folks are using today.
Except this is cloud-based versus an application. Is this installed? Is this an installed application?
Well, this one is installed, but you can also have it deployed through Citrix. But it is what we
through Citrix. That's screen sharing. That's not exactly a cloud-based system. It's basically replication.
Yep.
Yeah, because Citrix itself is an installed application.
Right.
Yeah. So you don't have anything that's running actually in a browser then?
Not yet.
Okay.
We're working on it.
Okay.
We do for not the clinician. So Hyperspaces are 70% of users use Hyperspace. That's nurses, MAs, care managers, doctors, like the gambit of clinical users.
Got
and then MyChart, which is our patient portal, that's web-based. Epicare Link is our affiliate provider portal that's also web-based. We have a variety of tools that are powered by web technology.
Got it.
So there's some variety there.
Okay.
Overall, this is the same Hyperspace I would use if this patient came into my visit or came into my clinic, but I had that video feed talking to my patient instead. So you can see I'm pulling in my live video feed. I can see the patient here. I can pin him to a particular part of the screen so I can keep it out of my way. If I have 2 monitors, I can make it so it always appears on my screen.
And that's video we're looking at,
this is
VIDYO.
Yeah. The integration looks the same regardless of who are using.
Can you scale that video down?
From this point, no, and that's part of the deep integration. With other vendors, we can't.
And you can't scale it up either. So pretty much
you can scale it up.
Oh, really? So it can get bigger but not smaller.
Yeah. This is just the limitation of our deep integration. We have a new type of integration, which is what Zoom uses, Cisco, Polycom, all the folks who are adding integration now, and that does support scaling down to smaller sizes. It's only this kind of old version of integration that doesn't support.
Okay.
So with that, that's kind of the extent. So I don't have to learn anything new except how to get into the video visit, and that was just a double click on that video icon.
Okay. Now, if this patient, let's say, was hypertensive, and the physician at this point wanted to see a current blood pressure reading, how would they do that?
Well, so I do have data about vitals. We also have home device integration. So if they have a blood pressure cuff at home, they're sitting at home and they're getting set up for their video visit, I can have a step of that check-in process, say, put on your blood pressure cuff, take that reading so that when the doc comes in, it's ready.
And how does that data get into this environment?
We integrate with Apple's Health Kit, Google Fit, as well as Fitbit and Withings directly. Withings is now Nokia. We try to work with more the aggregator side of things. We also support standards-based integration, and we just added Fire support for devices. So any device that supports the new Fire APIs for sending us data, we can also pull into the Epic experience.
Okay.
We let providers control who gets access to that data, so you're not giving blood pressure cuffs to everyone, you're giving them to your CHF patients. You're not giving your glucometer readings, you're not opening up glucometer readings to everyone, you're opening up to your diabetic patients. Steps are the most common example. Post-op knee patients, probably it's a little bit more important that you collect their steps than an average healthy 25-year-old.
And what is the range of vitals that you can actually get out of HealthKit today? What are you covering?
So we cover every device HealthKit integrates with, but that's not super wide yet. So blood pressure cuffs and glucometers are by far the most useful and widespread devices that integrate.
Right.
There's also digital thermometers, fitness trackers, scales, smart scales. I'm missing one, but I don't know.
ECG?
Not usually.
How about stethoscopes?
We can integrate with stethoscopes, but it's going to be vendor specific. So
and how would you present a stethoscope sound in this system, or an ECG?
Through the video. Well, the ECG is a little bit more. It would probably end up being through screen sharing, unless there was a shared system where you could see the ECG integrated.
So, in other words, you don't have a native way within the system to display, for example, audio captured from a stethoscope, and then play it so you can hear it.
Right.
Instead, you're screen sharing something else that's capturing it.
Yeah, and we can save ECGs directly to the patient's chart. It depends on what integration you have on the other end. ECGs are they're going to be a different type of integration than the stethoscope. Stethoscope is going to be like the IDYO, for example, supports. What's the name of the most popular digital stethoscope?
Well, there's a variety. There's the Think Labs unit.
Yeah, the Think Labs, yeah.
Got it.
So the Think Labs stethoscope is integrated with video, and so that's the feed that we can get through video.
Through video.
Yeah.
Okay.
But then on the ECG side, it doesn't make as much sense to send it streaming most cases, so you would actually save it to the patient's chart, and then the provider who is reviewing the patient remotely would still have access to it through probably something in like the media tab here.
So let's take a look at that for a minute, yeah. So the ECG report is essentially a paper report. It's not live ECG data, it's a strip. Yeah, got it. And that's not data, that's an image of data right there, right?
This one actually I think might be data. So we do have integration with a variety of ECG devices directly, and we can save that data directly into Epic. It's just not through the same integration as HealthKit. HealthKit is designed for the consumer at home. ECGs are probably going to have a clinical user at the other side collecting that data, and it would follow whatever integration you have standardly with that ECG.
Okay, got it. And can you, by